the endometrial biopsy and its role in the couple's fertility. The endometrium is the tissue that covers the uterine cavity. It has an essential role in embryo implantation, as implantation depends on an effective dialogue between the embryo and the endometrial tissue. Nowadays, it has been proven that an endometrial biopsy should not be performed as part of a basic fertility study in a couple with fertility problems. It only has to be carried out if there is suspected pathology or specific indication associated with a hysteroscopy. Here's where the endometrial biopsy has a valuable role once again. Having dismissed other causes of infertility in the couple and pregnancy is not achieved after going through studies and treatments. That is, for couples with implantation failure problems. There is evidence that an endometrial biopsy performed within 40 days before the embryo transfer increases the possibilities of implantation and pregnancy. As we can see, besides being able to diagnose and treat morphological disorders, chronic endometriosis, we can also improve pregnancy rates. It seems that the simple fact of taking a tissue sample from the endometrium, called scratching, can stimulate a molecular mechanism that will make the endometrium more receptive during a certain period of time. An endometrial biopsy consists of taking a sample of endometrial tissue in order to perform certain tests and studies. There are two different ways of performing a biopsy. Hysteroscopy can be done using small tongues to observe any abnormal condition located in the endometrial area. This would be a directed biopsy. At any time during the menstrual cycle, a very thin cannula can be introduced through the cervix into the uterus to take a sample of endometrial tissue. In these cases, the procedure is similar to a routine gynecological checkup, and it takes just a few minutes. It is performed in the consultation, and it is an outpatient procedure. As in any diagnosis technique where a tissue sample is taken, it can cause minor discomfort, like period cramping. Thereby, a previous preparation usually occurs with painkillers, anti-inflammatory tablets, and muscle relaxants. It is generally very well tolerated, and after a few minutes, the patient can carry on with her normal activities. For this reason, the Instituto Bernabeu Embryo Implantation Failure and Repeated Miscarriage Unit pays special attention to couples who could benefit from an endometrial biopsy in order to further the study and treatment of their case.